Let us today find our answers to the revised international classification criteria, diagnostic criteria, and exclusion criteria of Sjogren syndrome. Revised international classification criteria for Sjogren syndrome is a set of 6 criteria which for better understanding and remembrance are being split into two categories of symptoms and objective criteria. These criteria are as follows: the ocular symptoms, oral symptoms, ocular signs, histopathology, salivary gland involvement, and autoantibodies or serology. Criteria number 1 is ocular symptom. The patient may have symptoms like daily persistent dry eyes for more than 3 months, or recurrent sensation of sand or gravel in the eyes. And lastly, usage of tear substitutes more than 3 times a day. Criteria number 1 points out 3 ocular symptoms, and if any one of these is present, the criteria is considered valid or positive. Criteria number 2 is oral symptoms. Patient may have symptoms like daily feeling of dry mouth for more than 3 months, recurrently swollen salivary glands as an adult, and frequently drink liquids to aid in swallowing dry food. Now, same as we discussed for ocular symptoms, if any one of these oral symptoms is present, the criteria is considered positive. The third criteria, which comes under the category of objective criteria, is ocular signs. Two tests are performed, first being the Schirmer's test, for which a value of less than 5 millimeters in 5 minutes is considered diagnostic. The second test is the Rose Bengal test, for which a score of more than 4 is considered diagnostic. If any one of these tests is positive, the criteria will become valid. Criteria number 4 is histopathology in a minor salivary gland. It must show a focus score of more than 1, which is more than 50 lymphocytes per 4 mm square of glandular tissue. It is one of the most important criteria as it may lead the clinician to a final diagnosis. Criteria number 5 is salivary gland involvement, which is tested by 3 diagnostic tests to evaluate functioning of glandular tissue. The first test is unstimulated whole salivary flow, where a value of less than 1.5 ml per 15 minutes hints towards reduced gland functions. Secondly, parotid ciliography, a diffuse ciliactasias, punctate, cavitary, or destructive patterns can be seen, and a characteristic fruit-laden branchless tree pattern hints towards Sjogren syndrome. Thirdly, salivary scintigraphy, where a delayed uptake, reduced concentration, and delayed excretion of the tracer, that is technetium 99, is a hint. The criteria is considered positive if at least one of the 3 tests gives one of the above shown results. The sixth and last of the criteria is autoantibodies in the serum, which includes anti-nuclear antibody titers, the anti-Rho SSA antibody, and anti-La SSB antibodies, or both. Presence of any one or both is considered a positive diagnostic criteria. For a patient to be diagnosed a case of primary Sjogren syndrome, the first option is the presence of any 4 of the 6 criteria if either criteria number 4, that is histopathology, or criteria number 6, that is serology, is positive. The second option is presence of any 3 of the 4 objective criteria from ocular signs, histopathology, salivary gland involvement, and serology. If any 3 out of these 4 is present, the case is diagnosed as primary Sjogren syndrome. Secondary Sjogren syndrome is diagnosed if the patient is suffering from another well-defined connective tissue disease, along with presence of any one from criteria 1 ocular symptoms or criteria 2 oral symptoms, and presence of any 2 from criteria 3 ocular signs, 4 histopathology, and 5 salivary gland involvement. Exclusion criteria caters patients who have had a past head and neck radiation treatment, hepatitis C infection, AIDS, had a history of pre-existing lymphoma, sarcoidosis, graft versus host disease, or has been using an anticholinergic drug. Hoping that many of your queries have been answered today.